is quite less painful as compared to the FUT, where we have to take out a strip of the skin and put the stitches. Generally, people recover within 2 to 3 days after the procedure from a FUE hair transplant.
I want to ask you, what are the success rates of FUE hair transplants in particular?
So it is quite safe to say that the success rates of FUE hair transplant would be around 90%.
Is it scarless or it has some scars?
See, nothing is scarless. Whenever a clinic advertises procedure is scarless, this is misleading.
So if somebody gets hair transplant by FUE method done today, till when can they expect a good result or final result, let's say?
Final growth you see at around 12 months plus minus 3 months. So 9 to 15 months you can see the final outcome or the final results of the hair transplant. FUE is much better than FUT.
Hair transplant now is a known surgery. It's a known treatment for bald areas. किसी को अगर थोड़ी baldness है तो hair transplant के बारे में हम जरूर सोचते हैं. The problem is now we know a lot of different types of hair transplant. We know about FUE, FUT, body hair transplant and whatnot. And when we want to have a hair transplant done for us or any of our family members, we are often confused. Which type of hair transplant should I get it done? What should I talk with the doctor? How should I understand this? So many questions arise in our minds and we are confused by it. So let us today understand the intricacies of FUE hair transplant by our renowned hair transplant surgeon, Dr. Satya Saraswat. So welcome. So let us talk today about the pros and cons of FUE hair transplant. So the advantages and disadvantages in brief. What are the main advantages of an FUE hair transplant?
So definitely FUE is a well-established hair transplant procedure now, and we all know that till around 2010 or so, FUT was considered to be the gold standard, and slowly but surely FUE has taken its place all over the world because of various reasons. The first one is that the pain or the invasiveness of the procedure is less in FUE. It is quite less painful as compared to the FUT, where we have to take out a strip of the skin and put the stitches. Here just we have to extract one by one root, and the pain is very brief. It has a very fast recovery. Generally, people recover within 2 to 3 days after the procedure from a FUE hair transplant. There is hardly any numbness or tightness because of excision of a strip and closing the strip, the residual area in the back. And when we close it tightly, especially if the strip is very wide, there is a lot of tightness kind of feeling which is not there in FUE. So it is considered to be much less invasive as compared to FUT. Also, another advantage is that in FUE, you can easily extract white hair follicles or follicular units by FUE as compared to FUT. The transaction or the damage or when the hairs are cut during the process of excision or extraction, it is not permanent, because if a significant amount of root is remaining there in the donor site, it will again grow back, especially if the middle third or the lower third part of the follicular unit is intact, where the stem cell area and the bulb area is there. So the transaction is, in many cases, FUE transaction is not permanent. It is the only method by which you can take out the graft from the body, like from the beard, chest and back, which is used in specific cases, especially if your previous hair transplants, you have extracted a lot of grafts and the yield has not been good. It is also very good in tight scalp. So whenever the scalp is tight, which means the scalp can differ from person to person. If a person has very tight scalp, the mobility is less. In those kind of cases, FUE is much better than FUT. We can extract now a large number of grafts by FUE as compared to FUT, and now we are routinely seeing clinics coming out with number more than 6,000 or 7,000 or even more in multiple sittings by FUE. And the last and very important factor is, if the machine which is extracting the grafts in FUE has a counter, in that way the count of the follicular unit becomes very transparent. The transparency is not that much in a FUT procedure as we can have if the machines are good and sophisticated in showing the number of grafts in a FUE hair transplant.
So these are clearly those advantages which put FUE so much apart from FUT, which was
ahead.
Which was so much prevalent previously.
Yeah.
But the points where it was lacking was taken over by FUE, and so FUE immediately became a rage. So after the FUE procedure is done, How long does the recovery process take?
So as we talked about, generally it takes 3 to 4 days, but healing can vary from person to person. But if we see large majority of patients, they will heal, the donor side will heal, the recipient side will heal within around 3 to 4 days maximum. Sometimes there can be some swelling or some discomfort. Some people have slightly sensitive scalp, so they can have slightly longer pain in the donor or the recipient side. There can be some numbness for a couple of weeks or more in FUE, but that is not the case in general. In general, the healing is like 2 to 3 days or 4 days after the procedure.
So like suppose somebody gets FUE done. So लोगों को लगता है बिल्कुल सब ठीक हो जाएगा. Now I have got this transplant done. I want to ask you, what are the success rates of FUE hair transplants in particular?
So hair transplant and FUE hair transplant is just like any other medical procedure. There is no medical procedure in this world which is always successful all the time. There are a lot of factors on which the success of hair transplant depends. Mostly if patient related factors are considered, they are like the donor side and the recipient side related factors. And if the quality of grafts is very poor, then the success chances reduce. And if there are some medical problems, autoimmune disorders and other things in the recipient area, that can also lead to failure. So it is quite safe to say that the success rates of FUE hair transplant would be around 97%.
So considering so many factors.
And there are a lot of data now coming in. And many clinics have said that 2 to 3% cases, they have unexplained failure, which they were not seeing in many of the patients. And suddenly one patient comes who has poorer growth as compared to the other patients they have operated. And I'm talking about the standard clinic where a qualified doctor is doing the procedure and they are doing all the things as per the protocols.
So the doctor, on the doctor and the clinic side is good, but there could be something wrong with the skin or any other such problem.
Yeah.
So if you want to see a result of one of our FUE patients, you can click on the link above. So we all know that if there is a surgery, it will leave some scar behind. Yeah. So I want to ask you, what kind of scarring do we expect from FUE? Is it scarless or it has some scars?
See, nothing is scarless. Whenever a clinic advertises a procedure is scarless, this is misleading and it's unethical to say that there is no scarring. In FUE, there are micro dot scars when individual follicular unit is extracted from the donor site using a punch, as compared to a linear scar which is present in a FUT. So it is wrong to say that FUE is a scarless procedure.
So we now know so many advantages of FUE. I want to just ask now, what are the disadvantages or cons of FUE hair transplant?
See, when there are clinics, when they are trying to extract larger number of grafts, sometimes they transgress the boundaries of the safe donor area. Mm-hmm. Although safe donor area is not a linear demarcated area, it's not something which is demarcated by the nature. So the doctor has to judge as per the trichoscopy and all other factors, but still it is not a well demarcated area. Sometimes when you transgress the safe donor area, those hairs, extracted follicular units may not yield good growth and the life of those follicular units may not be long. Apart from that, if the scalp is very loose, then it becomes very difficult and tedious to actually extract the grafts by FUE because it doesn't need a lot of skill. You just need to learn that skill, although it is also a skill, but still many people who are not qualified, and this has a shorter learning curve. So many people who are not qualified to do the procedure or unskilled are also extracting the grafts by FUE, and they are coming out with terms like guaranteed and unlimited number of grafts. So a lot of unethical advertisement is going on with FUE in many places, and this has led to this procedure becoming like it's like something being offered in a marketplace. So it is not so. It's a very skilled procedure. It should not be. Every patient has to ascertain who is doing their procedure, the qualifications of the doctor, their credentials and all. If you over harvest the donor area, it can lead to a generalized thinning, which looks very bad. In a FUT, if you have taken out, if the scarring is bad, you can improve it by doing SMPs, whereas doing a SMP in over harvested FUE donor site is much more difficult as compared to, as we have seen, you're doing so many cases. And it's slightly more difficult to do in curly hairs, in African hairs.
Because of curliness inside the skin.
Yeah, and sometimes there are factors like splay, an excessive curl inside the skin. So these are the factors which can suddenly make the procedure much more difficult as compared to FUT, where we have to just take out the strip and then do all the harvesting under a microscope. So it's not a blind procedure, FUT, whereas FUE is a blind procedure where the punch has to go inside over the follicular unit and just cut the attachments of the follicular unit, and then you can easily harvest. If there are some factors by which the underlying follicular unit is curved or is difficult, then in those cases FUE becomes a much more difficult procedure and more transaction.
It may lead to more transactions, so less harvesting of graft should be there. So FUE has its limitations, and we have to see the benefits and the pros and the cons before we actually say yes to the procedure. So like if somebody goes for FUE hair transplant, what kind of results can they expect from FUE?
So FUE and FUT, whenever you are doing a hair transplant procedure, if the procedure is performed in a proper way and the patient-related factors are also, there is no problem with that, in those cases you get very natural growing results, growing hairs as a result of the hair transplant. And a good hair transplant procedure is one where nobody should be able to detect that you have undergone a hair transplant. So naturally growing hairs with a softer hairline and a sort of a artistry which goes into the hair transplant should make your results very, very natural if it is being performed in a proper way.
So if somebody gets hair transplant by FUE method done today, till when can they expect a good result or final result, let's say?
See, the timelines are that suppose today is day 1, at around 10 to 14 days or so, you will start seeing some shedding of the fall of the hairs, transplanted hairs, and that shedding goes on till around 3 months, slightly less or more at times. And then after the shedding phase is completed, you start seeing the growth, and in general you see around 10 to 15% hairs coming out. 6 to 9 months you see significant amount of growth. Final growth you see at around 12 months plus minus 3 months. So 9 to 15 months you can see the final outcome or the final results of the hair transplant. Although now we are seeing that many patients are having very good growth earlier also, like in 5 to 6 months also, especially if they have good quality hairs and they are in the growing phase and anagen phase, and many a times we see a quick growth also without any shedding of the hairs in the initial phase.
So it depends if the hair are in anagen phase when we transplant it, maybe they get better earlier.
Yes.
Right. So we've discussed a lot about FUE today. Do you think there are any other factors on which the success of FUE will depend?
Yeah, there are a lot of factors on which the success of the hair transplant depends. They are patient-related factor, they are doctor-related factor. A doctor should be well qualified and credentialed to perform this procedure. They should have a good team. All the equipments, instruments should be of the standard quality. The consultation should be ethical in terms of expectation. Then there are a lot of patient-related factors like the quality of the hairs, the recipient area, if they have any medical problems like psoriasis or autoimmune disorders like frontal alopecia and pattern distribution or alopecia areata incognita, which can lead to failures at time in patient. A lot of stress can also yield to poorer growth, as we know as telogen effluvium. Apart from that, if a patient is not following the post-operative instructions, this can also lead to a suboptimal or a poor growth if they're not taking the medicines which have been advised. Sometimes what happens, they have some thin hairs and the transplant is done in between those hairs, and the density at which we generally do a hair transplant is around 40 to 50% of the normal density at the donor site. So it's never 100%. And if you lose the existing hairs and do not take the medicines, this can lead to the hair transplant results becoming thinner over a period of time and can lead to poorer hair transplant results. So there are a lot of factors. Hair transplant is never a one-time procedure which is going to solve all your problems for your lifetime, whereas it is something where doctor is doing procedure and giving you guidance at one point of time, but at all other times the patient themselves have to keep on taking the care of the transplanted hairs.
If you want to know about cost of hair transplant, click the video on the left, and if you want to see result of one of our hair transplant patients, please click the link on the right.